Have a nice day, everyone. I'm here in front of you to discuss about the mental health related to pandemic COVID-19. So according to World Health Organization, the mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with her normal stresses of life, can work productively and fruitfully, and able to make a contribution in his or her own community. Thus, mental health refers to cognitive, behavioral, and emotional well-being. It is all about the people think, feel, and behave. People sometimes use the term mental health to mean the absence of mental disorder. Looking after mental health can preserve a person's ability to enjoy life. Doing this involves reaching the balance between life. So when you say about balance, you must know how to handle everything in your own way and not to be affected by negativity of the environment. To proceed, the COVID-19 pandemic has certainly resulted in an increased level of anxiety and fear in communities in terms of disease management and infection spread. Due to fear and social stigma linked with COVID-19, many individuals in the community hide their disease and do not access healthcare facilities in a timely manner. In addition, with the widespread use of social media, rumors, myths, and inaccurate information about the virus are spreading rapidly, leading to intensified irritability, fearfulness, insomnia, oppositional behaviors, and somatic complaints. Considering the relevance of all these factors, we aim to explore the perception and attitudes of community members towards COVID-19 and its impact on their daily lives and mental well-being. The worldwide COVID-19 pandemic has not only incurred massive challenges to the global supply chains and healthcare systems, but also has a detrimental effect on the overall health of individuals. The pandemic has led to lockdowns and has created destructive impact on the societies at large. Most company employees, including daily wage workers, have been prohibited from going to their workplace and have been asked to work from home, which has caused job-related insecurities and financial crises in the community. Educational institutions and training centers have also been closed, which resulted in children losing the routine of going to school, studying, and socializing with their peers. Delay in examinations is likewise a huge stressor for students alongside the parents that have been struggling with creating a structured meal for their children, teenagers, adults, or elderly. The crisis is engendering burden throughout populations and communities, particularly in developing countries. So, we may now proceed to the effect of mental health in the community. So first, the effect of pandemic COVID-19 on college students. This indicated the increased stress and anxiety due to COVID-19 outbreak. Multiple stressors were identified and contributed to the increased level of stress, anxiety, and depression thoughts among students. These included fear and worry about their own health and of their loved ones, difficulty on concentrating, disruption to sleeping patterns, decreased social interactions due to physical distancing, and increased concerns on academic performances. Secondly is the effect to young people. The COVID-19 crisis has significantly affected the lives of young people. So young people is between 15 to 24 years old, and available evidence points to an alarming surge on mental health issues among this age group. Loneliness, a risk factor for poor mental health, to a particular burden for young people. The school closures have had significant implications for the mental health of young people, as the schools are not just places where students develop and progress their academic skills, the shift to remote learning has resulted in an erosion of many protective factors that attending school offers, including daily routine, social contact, social and emotional support from teachers, sense of belonging to a community, and thus access to physical exercise. While many young people have been able to maintain connection with peers through digital means. So the loss of in-person interaction resulting from school closures could have long-term negative consequences for mental health.